Hello, my name is Megan Moran, and for my topic on non-traditional care settings, I chose long-term care facilities, specifically nursing homes. So hopefully by the end of this presentation, you'll be able to answer these questions. What are examples of long-term care facilities? How many licensed nursing homes are there in Florida? What is Harbor Chase's dementia care unit called? What two assessments are required in a nursing home? How soon should an assessment be completed if a significant change in the patient is noted? What reimbursement system applies to nursing homes? What act created that reimbursement system? How long should nursing home records in Florida be kept? Who accredits long-term care facilities? And what code sets are valid for nursing homes? Long-term care is designed to provide various services to meet a patient's health and/or personal care needs while they are unable to care for themselves. Long-term care facilities include rehabilitation facilities, skilled nursing facilities, and nursing homes. Nursing homes might be set up like a hospital and have a nurse's station on every floor, or they might be set up like a neighborhood. Some might have special units dedicated to specific issues like serious memory problems. Nursing homes are not just for elderly patients, they're for anyone who requires 24-hour care. As of 2016, there were 15,600 nursing homes in the United States with about 1.3 million residents. Currently in Florida, there are 691 licensed nursing homes, and that represents about 84,000 beds. A local example of a nursing home here in Gainesville is Harbor Chase. They strive to foster independence through a balance of support and engagement. They have extended congregate care, which allows residents to age in place and receive the appropriate level of care as their needs change. There's also an Alzheimer's and dementia care program called The Cove, which provides a supportive atmosphere for those living with memory impairment. So now we'll talk about federal regulations for nursing homes. The Centers for Medicare and Medicaid Services, CMS, have regulations required for long-term care facilities to meet to be able to participate in Medicare and Medicaid programs. The final rule was revised and went into effect November 28, 2016. It was meant to align with Health and Human Services quality initiatives, which include reducing avoidable hospitalizations, reducing healthcare-associated infections, improving behavioral health, encouraging and supporting the adoption of health information technology, and utilizing trauma-informed care. Federal regulations follow CMS standards and the desire to provide high-quality care in a cost-effective manner. So now we'll talk about Florida regulations for nursing homes. Under Title 29 Public Health in the Florida Statutes, Chapter 400 addresses nursing homes. 400.23.7 requires all nursing home facilities be evaluated at least every 15 months. A license is required for the operation of a nursing home. The Florida Administrative Code and Administrative Register have Rule Chapter 59A-4, which lists minimum standards for nursing homes. There is also a Gold Seal program in Florida that recognizes nursing home facilities that demonstrate excellence in long-term care and promote the stability of the industry, as well as facilitating the social, emotional, and physical well-being of the residents. Next, we'll discuss documentation requirements. Clinical records should have a face sheet that has demographic and contact information, and it should be kept up to date as changes occur. Facility-specific assessments like pain assessments or dietary assessments are required. Another required assessment is the Resident Assessment Instrument, RAI. The RAI is mandated by the Omnibus Budget Reconciliation Act. The minimum data set and care area assessment are part of the RAI. Newly admitted residents must have a comprehensive assessment completed within 14 days. If a significant change in the resident's condition is noted, a new assessment must be completed within 14 days of the notice change. Informed consent must be given for the use of restraints. In Florida, nursing home records must be retained for 5 years after discharge. HIPAA-compliant policy documents must be retained for 6 years. The health record should be kept confidential and secure, well organized, and readily accessible. Physical, technical, and administrative safeguards must be in place. So this is a sample policy and procedure I created. It's for creating a new record. It's basically what we just talked about. You can see there's a newly admitted resident has to have an assessment completed within 14 days of admission. And then after the initial assessment, a yearly assessment needs to be completed. And if a significant change does occur in the resident's condition, then a new assessment must be completed again within 14 days of that notice change. And then about the retention, that they need to be retained, the medical records need to be retained for 5 years after the resident is discharged. Our next topic is reimbursement and funding. The Balanced Budget Act of 1997 created the Skilled Nursing Facility Prospective Payment System, and it was implemented in July 1998. It is a per diem prospective payment system that covers all costs related to services beneficiaries receive under Medicare Part A. A 4.6% budget cut has been proposed for nursing home reimbursement in 2023. This would be a loss of $320 million and could be troubling for nursing homes that are already struggling to stay open. Medicaid underfunding is a large contributor to financial challenges in long-term care facilities. Medicaid is the primary payer for nursing homes. A survey by the American Healthcare Association and the National Center for Assisted Living found that 72% of nursing homes say they won't be able to continue another year of operation at the current rate, and over half of all nursing homes are currently operating at a loss. Now we will discuss certification, licensure, and accreditation. In the Division of Health Quality Assurance, the Long-Term Care Services Unit is responsible for licensing, registering, and regulating many healthcare providers, including nursing homes. The Commission on Accreditation of Rehabilitation Facilities accredits many aging services programs. The Joint Commission also accredits nursing homes. The Joint Commission Nursing Care Center accreditation is increasingly being used as a quality metric by large national payers. In Florida, this accreditation is recognized as a quality credential that helps increase reimbursement. To participate in Medicaid or Medicare programs, nursing homes must have a state surveyor complete a life safety code survey and a standard survey. All right, now we're going to talk about coding schemes. Since October 1st, 2015, nursing homes have been required to use ICD-10-CM codes for diagnoses. The principal diagnosis is the reason for the continued stay in the facility, and then for procedures and services, CPT codes are used. Security of protected health information is extremely important in healthcare. Long-term care facilities are a particularly desirable target for cyber criminals due to the number of deaths that occur. In 2020, an estimated 40% of all United States deaths occurred in long-term care facilities. To protect the facility, cybersecurity insurance can be purchased. Another possibility is to retain a team of professionals headed by a law firm experienced with healthcare law and HIPAA. So, to wrap up, long-term care facilities can be nursing homes, rehabilitation facilities, and skilled nursing facilities. Nursing homes are not just for elderly patients, they are for anyone who requires 24-hour care. There are many options for nursing homes in the United States. In Florida alone, there are 691 licensed nursing homes. Like all healthcare facilities, there are specific federal and state regulations to follow and certification, licensure, and accrediting agencies to comply with. Funding cuts are currently an area of concern for nursing homes, as many are struggling to stay open. And security is also a concern, as long-term care facilities are a particularly desirable target for cyber criminals. So this is a list of all the references that I used while I was writing the discussion posts that we did. So they're split into 2 slides. And here is the second page of references.